now we're going to move on to looking at some core video counselling or listening skills really, just some other things to think about. So our voice, essentially we may just need to think about our voice a little bit more. Again, when we're losing that one of those senses as to the person being in the room, we need to make sure that our voice is clear. It's we're just watching the pitch and the tone and the way we're speaking. So we may need to just tune in a little bit more and be more precise with our voice. So fast or slow, soft or loud, pitch, tone, intonation, our rises, our falls. Also sort of tutting or, if we're sucking on our lip or things like that. It's just about being aware, because obviously the client's tuning into that. Obviously it doesn't matter what the client does, but with us sort of talking, it's just about being aware if we're, if we're sort of, we are suddenly whispering or we're suddenly getting quieter and quieter and quieter. So it's really trying to, monitor that pitch and tone that's going on for us. So silences, obviously again, as counsellors we're trained, to use those silences, to hold those silences. It may be initially that we may not use silences quite as much until we build trust. As I said earlier, sometimes that trust can be built quite quickly, so we might be able to introduce silences, or using the silences quite quickly. It's wait until that trust is built and developed, and you've sort of developed a flow with the client really. As sessions progress, silences can become longer as the trust builds more really. So, on your first sessions, to start to try to hold long silences might be, counterproductive in that they're not quite sure if you've heard or they've heard, or the silence might be we might not be using that silence as we would do normally straight away with counselling. So if the silence is there, it might be, you might be questioning more, or just saying, you might want to just say, well, take the time, I'm still here. If you need me to repeat anything I've said, then then just ask me. So we might be just filling that silence initially a little bit more than we would do normally if we were face to face. If there's a lot of silence, or it's thinking about questions. If we ask a question and there's a silence, it's sort of looking to see whether actually that's a difficult question. It's really trying to work that out. We might want to ask the question again, or ask a slightly different question, and sort of, they might be looking for agreement from us as well. So when they say something, again in counselling, if it's something really quite profound and we might normally hold that, it might be that we need to just acknowledge that we've heard them, so we might be nodding in agreement, or we might be making some sort of statement just so that they know that we've heard them. They need, I think, initially that recognition that we are hearing them, that we're not just holding it, the silence for therapeutic sort of, as part of the therapeutic process really. So spotting emotions from a distance, so ask, be curious, clarify, so if we see emotions, it might be about us acknowledging them, or just being able to pay attention to that. It feels like that was really difficult for you, or it feels like that the emotion feels quite overwhelming. Is that how it is, or something? So it's almost paying attention. In the room, they know that you can see they're crying, or they know that you can see that this emotion's going on for them. But when you're at that distance, they may not be able to. Obviously, we don't want to go. We don't want to be really brash about it and go, "Oh, I can see you crying," blah 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 blah. Because actually they might want to be quite private, and because they're in their own space, they feel more able to cry than they would do if they were with you. But it's just gauging that. It's just being aware of being able to let them know that you can feel that emotion, or what's going on for them. So again, with disabilities, be open, be transparent about disabilities. I'm going to ask you about this disability or blah 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 that goes on for you. It's really important for me that I understand how things are for you, that sort of thing. But it's just take time, give the client the time to get into the flow of this and to tune into it. But it's just about being aware of all of the things that we talked about there. All of your normal counselling skills and active listening skills that would come out, it may just be fine-tuning them a little bit. So eye contact. So I think one of the biggest things for me initially was that, which again, after you've done a couple of sessions just goes, or even after you've got into the first 5-10 minutes of the session, really it goes. But initially it's that eye contact. So it can be quite disorientating, because if they are looking at the image of themselves, or also if they're looking at you or the image of you, actually their eyes are looking down. Their eyes aren't looking at you in the screen. So they'll only be looking at you in the screen if they're looking at the camera, and of course they're not, because they're looking at your face on the screen. It may be that they're looking at themselves. So it may be harder to hold that eye contact. So it's no better or no worse than face to face. It's just different, and it's just sort of getting into that way of working. We might find that we're looking at ourselves to check that we look, not so much that we look okay, but that we're in the centre of the screen, or that we look like we're doing the right thing or whatever. So it's just being aware of that it's different. When we're in a counselling session, we are using that eye contact, or we have that eye contact. Whereas, as I say, if we're looking at the client's face, actually it looks like we're looking down. So yeah, just be aware it's different, which is why, at the end of our training session, we did a practice session, and I would absolutely encourage that. Of course, that's probably what you're going to do. You're not going to go straight in and do a video counselling session with someone. Have a practice, have a go, see what that feels like. Body language, we may need to be more pronounced because of the distance and the lack of being able to them see all of you, or you see all of them. So it may be that we're slightly more exaggerated with our facial expressions. We need to convey that response. We need to really open our eyes. We might need to get closer to the screen. Especially when it comes to the end of the session, if a client is talking, and we're close to that time boundary. Normally in a session we might be getting up at that point, or moving forward, or making our way to the door, and of course the client will get that cue. We haven't got that when they're we're just on a video screen. So it is though still coming closer to the screen, and actually not being afraid to be Claire, we've come to the end of our session now, speaking up and having to speak over them and just move forward, and so that they can see us moving in the screen, so it just jolts their attention slightly. It may be that, we get clients that talk and offload. It may be that we do need to just hold our hand up, or to, just to try to sort of get in there and be able to, we're going to interpret, we're going to, sort of just interact with them in that way. And again, if you have 3-4 sessions and you find that they are literally just talking, and you're not being able to get in, at the start of the 5th session, it might be, I realise, or I can see how, how does it feel that you offload in these sessions, that you can talk, and I've noticed that you're able to unload, and there's a few things that I've talked about that you've talked about that would be really good to come back to. Are you happy for me to put my hand up if I wanted to say something, or I wanted to look at something a bit further? Make that plan with them. Talk about that with them. How would it feel if I can just, so that that I've got something that we can maybe discuss around, or that. So just keep that communication open with them. So lack of them being in the room, as I say, it's the lack of the visual cues. You need to be able to convey that empathy. So just be aware of that. Explain and be open and descriptive with your words if you haven't got the bodily reactions if they can't see your body reactions to what they're saying. It's about being open and telling them how you're feeling, or telling them, to convey that empathy. We might show some sort of bodily movement when they're face to face. It's about saying to the client, wow, what you've said, I can really feel this, or I'm feeling really this. And we might say that anyway, but it's just being more pronounced with that, because they can't actually see the body language that goes with that. Counsellor may need to talk more, so verbal versus head nods, yes, I see, yes. So where again within counselling, if they're in the room, we may just be giving those sort of non-verbal cues. It may be that we just want to, okay, I see. So that we there's just a little bit more, because a slight head nod might not come across or be conveyed as much on the screen as it would be if we were face to face with them. So effectively interrupting, I've talked a bit about that. We may need to be more creative or assertive with this. If they're on long rambling monologues and we need to just get in there, we may need to move forward. We may need to use ways of attracting their attention. Assumptions, be more aware. We may be filling the gaps of things that aren't visible, and that's not wrong. It's just about being aware of what's going on with that. So again, we can't see them as a whole. We can only see a small part of them. We may be filling in or making assumptions about someone. It may be that they're always in their pyjamas when they come to their counselling, because they're in their own house. I wonder what sort of assumptions might come for us for that, or what might be, what might unconsciously come up for us with that, and what assumptions we might make around the client. But actually, do you know what? They don't realise, that I'm in my own house and it's 10 o'clock in the morning. Why wouldn't I be in my pyjamas, sort of thing? So just be aware of that. So verbally noting their body language as well. So, again, if we're face to face, we might pick up on those things and say that again, it's doing exactly the same, or it looks like, your body's tensed up, or it feels like, this is going on for you. Is that right? Am I seeing that right? Those sorts of things. Be open, use our voice with that, use the words. Dealing with strong emotions, as you would in a normal session, but it may be about acknowledging verbally that you can see that they're angry, they're tearful. So we talked a little bit more, about that a bit earlier. So it's just being able to name them verbally, whereas actually we might just hold it. If we were face to face, it might be actually verbally acknowledging that. Okay, so confidentiality and privacy. So it's important, again, to contract about this right at the beginning. Again, I will go through how we contract in our service. But confidentiality and privacy are different, and explain to the client what they are. That confidentiality means, how we treat the treatment of their information. And breaking confidentiality, so our normal confidentiality policy that we would talk about, but privacy, okay, so they need to understand that, not only confidentiality, this is our confidentiality policy, but also about privacy, that they know that you are in a private room, that nobody is overhearing, you're in a private counselling room, that the service that we use, the online service counselling rooms that we use are private, nobody can hack into them and nobody can record them, that's why we use them. Also as well, about their privacy, so for them to be really aware who else is in the room, or does everybody know that they need to be out of the house at this time, or does everybody know that they do need to be not disturbed, so it's really important that they understand about privacy and confidentiality and how that's working for them, so that they can really engage, or be informed of being able to engage openly into the session. Interruptions, for the client, questions, be open. Is that someone that's just come into the room, or can I hear somebody in the room with you? Be open, be honest, and be transparent with that. Find out, they might say that's just my brother who's, he's on the computer in the corner. Okay, we need to know that, we need to find that out. Again, in the contract we talk about this with them, and we inform them that at the beginning, so I'll come back to that. Again, we'll talk at the beginning in your contract, in your first session, talk about interruptions. So you'll say to them, so if I won't be interrupted at this end because I'm in a private counselling room, no one will come into this room. But if I hear someone come in, or if you want to just, how interesting, we've got interruptions outside. That is people outside of our building. That is not other people. Interruptions, there we go. There's an example of interruptions outside of the window. So what we will do on our first session, and what they will get in the contract, is what to do with interruptions. So if you would say to them, okay, so if somebody comes in and you need to end the session, you know where the X button is, you leave the room. And then I will sit here and wait, and when that person has left the room, or you want to continue the session, you just call back in via the link in your email as you did to initially come here, and I will be here until the end of your session. It might be that, if you might say to them, okay, so if we have an interruption and someone comes into your room, what would you like me to do? I will stop talking, and I will let you lead the session as to where we need to go. And you might talk about how, this is their space, it needs to be private for them. So, if somebody comes in, would they like it to end? Do they want to just get rid of them? So work out a plan of action so you both know what happens if somebody comes into the room. Again, boundaries. It allows you both to understand what's going on and what you need to do in what different situations and circumstances. Interruptions with yours, like I've said, if there's noises outside, then you let them know that's what's going on, but you let them know you're in a good, a safe environment, or a quiet counselling room. No one will interrupt, that sort of thing. Glitches, bad line, again, talk about it. Again, that will all be in the email that I send out to them initially. That's all explained, okay, so that's all within the first email. So again, you're laying down those boundaries. We explain what happens if there are any glitches, or if it's a bad line, or if it cuts out. Again, when you first come onto the line, you're going to be saying to them, can you hear me okay? Can you see me okay? I can hear you okay, I can see you okay, and off you go. But you'll talk about what will happen. Again, if the line cuts out, you will make a plan of action that you will sit and wait for them until the end of their counselling session. So if they want to ring back in at any time. I also give them the counselling mobile phone for the service, so that if they just can't connect to the room, then they're able to call in on that. And you can then make a plan of action of what you're going to do there. Okay, so again, just be open, be lay down what you're going to do if these things happen. If they disappear from the screen, what would you do in face to face? Really, it's just hold the space, let them know that you're still there. It may be that they're overwhelmed, or they're really emotional. It may be that they just need to walk away, or they go out to get a tissue or whatever. Just hold that space. Let them know that you're still there. Reassure them that they can take their time, and if there's if it's near to the end of their session, let them know how long they've got left. Toilet breaks. Okay, so it's different, isn't it? I mean, obviously, I think I can probably count on one hand in the 15 years that I've been seeing clients, how many clients have needed to go to the toilet. But if a client needs to go to the toilet, they will ask, can I just go to the toilet? Yeah, of course you can go to the toilet. So same online, then you might find this happens more because they can go to the toilet because it's just there, and they're in their own home. So again, same thing really. You make a plan. You talk to them about that. If they need to go, can I go to the toilet? Yeah, of course you can. I'll be sitting waiting here, or would you like us to end the session and you give me a call back when you're back? You ask them. You work that out. You make a plan. So yeah, it's just sort of, I guess it's planning for all the eventualities so that you all both know what's going to happen and you can feel safe and secure in that. Ending sessions and timekeeping. So it needs to be done verbally, so we can't use our body language. So giving time warnings can be really helpful. Again, back to what we said before about sessions can be really intense really quickly. So it's bearing in mind that you can almost feel in this time warp and the session has just gone before you realise. So again, make sure you're really keeping an eye on the time as we would normally in counselling, and sort of give time warnings and we've got 10 minutes left or we've got 5 minutes left, and as I said, remember about the soft close. So we've got 5 minutes left. Can we just sort of bring it back to the here and now and talk about what we might be doing after the session, that sort of thing. Okay, and again, boundaries, hold firm as you would do in face-to-face. 50-minute session is a 50-minute session. Same as we would in face-to-face, the session ends at 50 minutes. And then the last thing in this section is about mental health issues, managing difficult situations, sort of safeguarding. I think sometimes this is one of the biggest things that counsellors worry about. What if I have a safeguard issue? What if I have, somebody suicidal or that sort of thing? Do you know what? It is just the same. You would do exactly the same as a face-to-face session. That's all I can say to you, because what's different really? If a client was suicidal in the session, what would you do? We would find out more data. Have you got a plan? Have you, has this happened to you before? Have you got a care coordinator? We would find out details, wouldn't we? Have you got a plan? What are you going to do? How, blah, 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 blah. We would, home in and get those details. We do exactly the same as we would do when it's on video counselling. We will have their GP details as we would do normally, and if they've signed the same confidentiality agreement, they know when we make disclosures and when we don't. If they suddenly, it would be the same if they suddenly said, I'm suicidal, and hung up. It would be exactly the same as if they said they were suicidal and got up and left the session. What would we do? We would make out a professional judgment in that time. We would talk to counselling coordinator, our safeguarding lead, and if we felt that we needed to call the GP, we would call the GP, So it's no different, safeguarding exactly the same. It's no different. You deal with it in exactly the same way. If you can deal with safeguarding issues and suicidal clients face-to-face, then you can deal with them online. You just work in exactly the same way. Okay, thanks.